Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frankie Smith Funeral Home, Ohio University Lancaster, and Lancaster Fairfield Community Action Recycling and Litter Prevention.
Hello, I'm Lisa Hooker, and I am hosting Fairfield Today. This day, we are on location at Fairfield Medical Center's outpatient therapy services, work life, and sports clinic location on East Main Street here in Lancaster. Many of you may have been here because they do a number of things. My first guest today is Corey Callahan, the physical therapy supervisor. And Corey, that's an awfully long name, so you must do a lot here. Can you tell me a little bit about those services you provide?
Sure. We house physical therapy here, occupational therapy, speech therapy, and audiology all in the same building. And we see quite a wide range of patients from pediatrics all the way to, and I think we've had 102-year-olds here as well. So we see quite a range of patients, diagnoses anywhere from birth issues or cerebral palsy to patients who've had strokes or other neurological events, orthopedic conditions. So a really wide range. And then we have some niche areas, women's health we work with as far as physical therapy. We do some lymphedema treatment here, custom foot orthotics, we take care of hearing aids, so a really wide range of services.
It sure sounds like it. What's the work-life piece? Is that something like the companies might want to take advantage of?
Absolutely. We are actually a CARF accredited work-life program. We take care of anything from workers that have not been working for quite some time. They may come in up to 8 hours a day, 5 days a week doing work simulation. We provide counseling through a licensed counselor, really just whatever we can do to get the injured worker back. And we actually provide services to the community also as far as ergonomic assessments, training in the workplace. So we have quite a few services on that line.
Great. And then, of course, the sports clinic is the third piece of that long title. That's probably pretty self-explanatory, but is it formal athletes like students, or is it maybe the Sunday athlete the weekend warrior? That's what I'm thinking of. Do you help both of those folks?
Absolutely, a combination of the two. We have athletic trainers now for Lancaster High School, and we work with them very closely, but we do work with the weekend warrior also. It's a pretty good mix. We see some college athletes from the local universities, and it's really nice. That population is fun for everyone, also because they're so motivated and anxious to get back to the court or the field.
Well, great. Appreciate that explanation as to what you do here. I know this is an important piece of Fairfield Medical Center. The parking lot is always full, and when you come and go from here, that lobby is always pretty full too, so I know you're very busy. Today's topic, though, is trigger point dry needling. And I guess the obvious question, Corey, is what exactly is trigger point dry needling? I'm a little afraid of needles, so tell me what it is.
We won't make you a subject today, though, but trigger point dry needling is much what it sounds like. It is a dry needle. There's nothing injected. Essentially, it's to address trigger points, and trigger points are taut bands of muscle. Most of us are familiar with the trapezius muscle here up in the shoulders. You hold that tension, and it's very uncomfortable. It can refer pain other places. It can actually lead to headaches. It can cause jaw pain or tension, but you have those trigger points throughout your body. And so some folks with back pain, the source is muscular. And so for a long time, therapists have been dealing with these areas by doing pressure, basically digging into those muscles, types of massage. But years ago, one of the physicians that was providing trigger point injections, which is usually lidocaine or some other type of anesthetic, thought, wait a second, maybe it's not the medication and perhaps it's the needle. And so she experimented by dry needling or needling without medication and found that the results were nearly as good. And so for many years, physicians have been doing some dry needling, and for at least the past 10 or 15 years, physical therapists have been utilizing this modality in the clinic. We've been doing it here for several months now and have seen some really great results, both with patients with chronic and acute pain.
Is it what's coming to my mind is acupuncture. Is it similar?
Very common question. The only similarity is the needle we use. We use very thin filament acupuncture needles, but beyond that, the differences are a little more stark. So acupuncture is really an Eastern medicine type philosophy. So it deals with meridians and energy, chi flow through the body. So really what this is a Western medical approach to use of the needle. So we are just identifying those trigger points, inserting the needle, and at that point, chemical and electrical changes changes occur right there at the muscle, which leads to the relief of the muscle. So it's probably the best way to put it is we're resetting the muscle.
Great. Well, we're going to move on over here. So as we go, though, what types of conditions do you commonly treat with this technique?
Sure. As we mentioned, chronic pain is a very common thing that we will treat. Chronic pain associated with headaches and muscle pain here. But the needling can improve muscle function or strength as well. So, for example, we may have a patient who comes in with knee pain and is really overutilizing these quadricep muscles, but not utilizing the muscles of the backside. And we have and can identify trigger points there in the gluteal musculature, needle those muscles, and get an immediate improvement in the function and output of those muscles. So anything from pain to imbalance of muscles to improving muscle flexibility for a muscle that is contracted after an injury. So yeah, a lot of different applications so far.
And what does it feel like? It looks like we're going to maybe
I'll let
have
Julie
a
tell you a
demonstration
little
here.
bit about this is Julie, our occupational therapy supervisor. She is so graciously volunteered to be a victim for us. She's undergone this before, so this is not her first go around. But it varies per the person. Through the course, we had many needles stuck in us, so I can speak from experience there. Sometimes it's a little uncomfortable as far as the needle going in. Sometimes you really don't feel that at all. With the needle in the trigger point or in the muscle, it can feel anything from an achy or a deep. It can reproduce the achiness that you feel with your symptoms. Sometimes it's a little sharper. What we're looking for typically is what we call a twitch response, where the muscle will actually jump a little bit, and that's really the gold medal of dry needling. We're looking for that. That's what gives us the best response. And so you might
does the twitch mean the muscle has released and you can see that?
Yes, you'll see the twitch. Now, the release of the muscle you may not see as well. Now, they've looked under ultrasound and we'll see a change in what the muscle looks like. We won't see that physically, but we may get a good twitch in there. And typically, we may get multiple twitches in an area like this. So I hope we'll see that. So we'll do a quick session here with Julie and give you an idea.
You talk through what you're doing.
And basically, it's a very clean type of procedure in the first place. So typically, we'll just prep the area with a little bit of alcohol, let that dry there. Safety always comes first. So any area that we're concerned about any other structures, we position very carefully. We know our anatomy such that we're staying away from any structures that are important. And in this case, the lungs are the most important. So I've got her up in this position here where we'll actually separate that muscle, and I'll be needling directly toward my other finger. So we won't have any structures involved that are in trouble. So it is just a small single-use needle. We dispose these after the only use. And I would have done a lot of education with her first. They sign a special consent, and she's quite aware of what to expect and what the risks are. She knows, so I won't go through all of that now. But basically, she knows what to expect already, and we've already found the areas early. I did a little bit of early work with her, and she's got some pretty good knots right in there. And so that's where we're going to aim. So more or less, I will take up the muscle there, and we will get right up in that area. Insert the needle. Make sure it doesn't fall out, and then we're going to advance it slowly. And typically, I'll have the patient tell me what he or she is feeling and let me know. But we're going to work it right in there. We're hunting a little bit for a twitch. Sometimes you'll see it. Sometimes she'll feel it more than anything else. We'll move that needle around. What are you feeling so far, Julie? Pressure. And a lot of times pressure is a very common feeling. And sometimes you'll get into some tough tissue there that it moves through, but more or less.
Isn't that the goal, to kind of move it through?
It's actually physically break. I've got a little twitch in there. But that's what we're looking for. And typically, I may do 2 or 3 needles in a particular area, and what we're looking to do is to work it until the little twitches that are happening in there are finished, basically. And then at that point, we're going to complement it with stretching, posture education, strengthening certain muscles. So it's really not a standalone treatment. It's something we're going to do as an adjunct to other treatments, because if you needle that same area, yet she continues to go back to the computer and sit in that same position,
exactly.
and it will perpetuate. So we'll do things to help change or break that cycle.
So how many times would this is this a one-time procedure? How many times would this need to be done for Julie to feel significant improvement?
Sure. Usually the patient will feel some relief within 2 to 4 visits. Sometimes we'll go a little bit beyond that. And for her specifically, she has issues through here, but she's also has some neck pain. So one session I may needle the muscles here. Okay. The other time I may work up a little bit closer to the spine and some of those muscles. So it really depends on the patient in that regard.
You talked a little bit about the improvement. So part of it would be involving the needle. Part of it would be involved that education and posture and stretching and all that type of thing. So if you do 2 to 4 sessions, depending on the site, and I'll say the hardness of that muscle you're trying to break through, what type of improvement over time, I mean, more immediately than over time, could Julie or another patient expect?
Sure. Now, initially, Julie may feel a little sore, and we didn't do a lot there, but if we get a lot of contractions out of there, you almost feel that the muscle's been worked as in an exercise. So you get maybe some soreness for the first 2 hours to maybe 24 hours. After that, typically, she's going to feel a release of tension in that area. She may experience that relief till the next time I see her, at least. Ultimately, though, through changing the posture, changing all of that, we're looking to really get a lasting relief. Now, that doesn't mean to say that she may go through some stressful events or have a lot of time on the computer and then have that occur again down the road, and then it may be something we can address again. But it really does, with a cumulative effect, provide a lasting benefit.
How much time between the sessions? Does it depend on the muscle and the person?
Usually so. Typically, twice a week is about as much as we would address someone with needling. So if we're seeing her more often for something else, we might space that out a little bit.
So if a typical thing would be you do 2 to 4 times, you might be able to work on an area just in a 1 week period.
A week or two, we can really see some changes quickly, and that's what we've noticed is, we've worked a lot over time just with putting pressure on the muscle and such, and that's often painful for the patient as well. And this gets a faster response and a much more effective response.
Do insurance policies cover this treatment?
They do, and that's where the confusion with acupuncture sometimes gets in the way, because most insurance companies don't cover acupuncture. This is billed as manual therapy, which is a physical therapy charge that we use quite regularly, because essentially it's the same thing we used to do externally, but now we're actually doing internally, but it's still a manual. So again, Medicare and almost all other carriers do cover that. So
I think I would have been okay to do this had I not seen you actually do it. But I think that the people have to maybe get beyond that and understand the benefit, like so many other things. Whether you're working a limb and they've had surgery, if they've broken it, and it's like, oh, it really hurts, but you have to go through that, to get the benefit from it. Are there side effects from this that people should be aware of? It's probably in all that paperwork, but just generally you'd want to share.
Mostly the soreness is the biggest thing, and again, it isn't comfortable. I tell folks it's not as if you would say, oh, I'd love you to do that to my shoulders like a massage, if you really didn't have a real issue. But I guess as a testament, Julie and some of our other therapists have come back and again said, as we've practiced on them before or worked with them initially, have said, oh, can you do that again? So I think that tells the story. It's not always the most comfortable thing initially, but it really provides the benefit the rest of the time, so it's worth doing. But as far as other side effects, no, they're really, other than being cautious of structures and such, there really aren't any negative side effects.
Well, it sounds like a lot of other physical therapy procedures, sometimes they are uncomfortable as you're healing and getting back on your feet or getting your strength back, that this would kind of fit perfect into what you do here then.
Absolutely, it fits well, and it's easy for us to say, there's no pain, no gain, but it really does apply in many situations.
Well, great. Corey, I appreciate you explaining the trigger point dry needling, a new procedure here that has been offered in the last couple of months. And if you're interested, we'll give you information here when we come right back. But we are going to take a break. We'll be back with more with Fairfield Today.
Body language. Without saying a word, it can tell you so much. Like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
Welcome back to Fairfield Today. I'm Lisa Hooker, and today we are on site at Fairfield Medical Center's Outpatient Therapy Services, Work Life and Sports Clinic on East Main Street here in Lancaster. My guest is Corey Callahan. He is the physical therapy supervisor here, and we just talked to you a little bit about trigger point dry needling. Now we have moved on to Alter G. Now, Corey, this looks like quite a contraption. Can you tell me what is the difference between the Alter G treadmill and a regular treadmill that our viewers probably are more familiar with?
Absolutely. Well, effectively, it is a regular treadmill underneath all of this extra stuff here. And this enclosure here zips into a pair of shorts that are neoprene that our wonderful volunteer is wearing right now. And that creates a not exactly airtight seal, but a pretty good seal. And then this here will inflate with air in order to unweigh her, even down to 20% of her body weight. So that's where it differs. It really allows us to work with a different patient population.
So what types of conditions would you treat with this type of machine versus a regular treadmill?
Absolutely. With this machine, we can work with folks who have gone through an orthopedic surgery or injury. Maybe the physician has said, no, you're only allowed to bear 50% weight through your right leg. We can actually calibrate this to 50% weight bearing and allow the patient to do a very normal pattern of walking, whereas out here in the parallel bars or in another area, we have to really change that pattern or use assistive device. In here, she's really free to walk, for some athletes to run. So we'll see some athletes that are coming off of stress injuries, fractures, or sprains, injuries, and allow that athlete to gradually work back up to a full speed. We've had some folks that have not walked in some time that are just getting back to walking, maybe long rehab stay. We have a bath bench over here, so we've had folks transfer from a wheelchair directly into the Ultra G and be able to stand and ambulate for the first time in quite some time. So
now that is a true blessing and a miracle too, so that's wonderful. So what what will it feel like?
It's interesting. It really
have you done it?
Absolutely. It's a buoyant feeling, I guess. I'd liken it a little bit to walking in water because it really does take the weight off of your lower. If you put enough resistance or enough air in here, it really feels almost that you're gliding a little bit. It's hard to even get your heels down if you put it all the way to 20% of your body weight. So it's really nice. I'd like to mention, and I forgot to initially, we received this earlier this year through a grant from the Aladdin Shriners locally here. So they've really blessed us in a number of ways over the years, and so this is something that they accomplished for us, and so we're very grateful to them.
That was nice of them to do, and so many people will benefit from that. So you talked about the people who could benefit, so I wouldn't want people to think they'd have to be a runner to use this.
Not at all. Really, patients of all different levels and abilities, from walking to running. I mean, it is a very good treadmill. It'll go up to 12 miles an hour. It'll do a reverse for several miles an hour if we wanted to have a patient walking backwards. So anyone from the person who is really just beginning to walk on a walk for the first time in a while or on an injured limb to someone who is really training and ready to get back to cross country or track or marathoning.
Well, I know we want to see how it works, but the last question I have, you want to show us first, and then we'll finish up?
I'll show you real quickly. This is my boss here, Carolyn, who has volunteered to be our willing participant. But it's very simple. Once we have her zipped into the machine, this whole contraption lowers to the floor, and then we have her step in and bring it up and zip her in. At that point, I'm going to push start, and it's going to calibrate. It's going to weigh her first. It won't display the weight, so we don't have to worry about that. But once it weighs her, then it will be able to decide just like this. Has a little motor up front. So we'll give it just a moment. I'll mention now, it's neat as well. We can actually put the patient in facing the other direction. So if we're working on standing tolerance, we can put a game or an activity up here and have the patient work on that in standing with less, and they can exercise in here as well. Okay. So in just a second, it'll say that she is calibrated, and at that point, I'll start the treadmill. And we can change the weight here from 100% of her body weight down to 20%.
Warm air, cold air in there, and not really room temperature?
Room temperature. I don't think it feels too funny in there necessarily. So once that is set, she is ready to go. So I'm going to increase the speed of the treadmill, and she'll start a walking here. We're going at a pace. And then from this, I can control within 1% from 100% of her body weight down to 20%, just like this. And what she'll feel as she goes here is starting to almost lift up a little bit. And in fact, if we put it all the way to 20%, it's difficult for someone like her to even get her toes on the ground. So it really gives us a lot of flexibility. And the window here allows us to watch the patient and to give advice as far as what he or she is doing. So it's really nice.
What are you looking for as you look through this little window?
We're just looking to see what kind of pattern. We're trying to see if she's taking equal steps, if she's favoring one side versus the other. So it allows us to really, anything short of getting our hands on her legs, to observe what she's doing.
About how long, when a person comes for treatment using the Ultra G, about how long would they be in the unit? My guess is it would be multiple visits, but how many times would they start out with, and what would they work up to?
Well, it varies a lot. Again, we've had those patients that we brought in that really haven't walked in a while, and he or she may stand in here for a few minutes, walk at a very slow pace for just a short bit of time, and 5 or 10 minutes is all. We have also had some athletes who are coming off of maybe a stress fracture in the lower leg who will work up to being in here for 15, 20, 25 minutes of a little more vigorous activity.
How many treatments would be, I'll say, typical for a recovery injury to come and use the AlterG?
Okay. Recovery injury, I typically will see someone between 6 and 12 visits, maybe not with the AlterG every time. For example, some of these athletes, they'll start here, they may progress to the regular treadmill or other dynamic sport-specific activities here in the gym.
So you would start here and then move to a regular?
Yes, it's a great place. For some of them, we would start here. Now, we may have an athlete who comes in off of a rough ankle sprain, and then this would really be the end game. We'd get him or her into the machine to really test running again for the first time, and then the next thing is to be sport-specific drills.
How does somebody qualify to come and use this machine as part of their treatment?
Sure. It's not something that a physician even has to write a special order for. It is just something that would be between the therapist and the patient. Is this appropriate? We have had a few referrals so far that specifically mentioned the treadmill and said, hey, we'd love to have you use the treadmill, which I think will happen more as more folks are aware. There aren't too many other clinics in Central Ohio that have them, so we're very privileged to have the opportunity.
Again, another reason why Fairfield Medical Center is not your typical medical center, and we are so glad to have them to be part of our community. Corey, thank you so much. Corey Callahan is the physical therapy supervisor here at Fairfield Medical Center's Outpatient Therapy Services, Work Life, and Sports Clinic. We want to thank Carolyn and Julie, his two willing volunteers today, as he talked about trigger point dry needling and the AlterG treadmill. We're going to take a break and be right back with more on Fairfield Today.
Here's to the things that can keep us safe. Those we use all the time with hardly a thought. Those that are silently standing by to save our lives. And now, those that we carry with us everywhere we go. Many mobile devices will now bring you wireless emergency alerts, real-time information directly from local sources you know and trust. With the unique sound and vibration, you'll be in the know, wherever you are.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
Welcome back to Fairfield Today. Today we are on location at Fairfield Medical Center's Outpatient Therapy Services, Work Life, and Sports Clinic on East Main Street. My next guest is Linda Ferguson, and Linda is the Project Search Coordinator at Fairfield Medical Center. Linda, how long have you been with the medical center?
This is our 5th year.
Okay.
We started 5 years ago, so it's my 5th class.
Wonderful. So what exactly is Project Search?
Project Search is a program for students that are 18 or above. They have finished their high school credits and they continue on with their high school, so they do a social graduation. But they come here for their last year and they do three 10-week internship sites during the school year.
So 3 different locations?
3 different within Fairfield Medical Center.
Yeah, three different places with. Got it. Okay. And is this beneficial both for Fairfield Medical Center and the students to have this program available?
It definitely is. Fairfield Medical Center is the host site is wonderful. Our program, I'm a teacher from Fairfield Career Center, Eastland Fairfield Career and Technical Schools, and then we also collaborate with, it used to be BVR, but it's OOD now, which is Opportunities for Ohioans with Disabilities, and Fairfield Medical. So we all collaborate together, which makes it a wonderful transition year into that competitive employment, into that work world.
And how many students do you work with?
I have 9 this year. I've had 10 has been my most, and our first year was 6.
And so what makes the program so successful for these students and Fairfield Medical Center as one of the host sites?
There's so many different reasons, and every year just keeps growing. You know, we have 16 school districts that feed into Eastland Fairfield, so those students are the ones that have the opportunity to be part of Project Search. And so I've worked with lots of different school districts as well. So it's such a collaboration with so many different resources with DD side of it, with the hospital departments and supervisors, with the work side, with their parents, with the students, and getting the students prepared to be in the workforce, be successful, have a opportunity to have a say in where they want to work and what they want to do. And I think that's been just, they feel so good at the end of this program. Their self-respect, how they feel about themselves, and who doesn't want to work with someone that's feeling good about themselves? And they definitely do a great job and get a lot of opportunities.
After Project Search concludes that last year for the students, what do the students go on and do? How does that work after the Project Search is over?
Right now, our school district, they graduate in May. So at the end of May, we just had a student go out for an interview yesterday. We're looking right now for employment. So by the time we're in our third internship site, third 10-week internship site, and we are actually taking students out into the community. So for example, if our student is from Pickerington area, people from Fairfield County Board of DD, job coaches, are taking them into that community and looking for jobs, of course, so the transportation issue, and they can be successful. We've also had students work here. So it just depends, but right now we're looking for jobs. The whole purpose at the end of this program is for competitive employment, for their students to work at least part-time to full-time.
Do the schools maintain a role in this last year and in that whole job search process, or do they basically get turned over to Project Search separate from the school?
They're definitely. We have team meetings every 6 weeks, someone from their home school, someone from Fairfield Career Center, myself, and a supervisor from this department and DD. So every 6 weeks from the beginning of the start, they're right on, which makes it so successful. I've never worked with such an unbelievable team.
Well, March is the month in which we celebrate Developmental Disabilities Month, and certainly this is appropriate in spreading awareness and making people aware of Project Search, what it does and how it helps. How important is that piece, community awareness of what these students can do and what we are doing to help them find employment?
Of course, we do it every month. This is just an extraordinary month that we can celebrate that. I think just like Project Search, having Fairfield Medical Center open the doors and I think they're working real jobs in dietary department, up on the 3rd floor, being the nurse assistant. The students, yes, they might have a disability. We all have strengths and weaknesses, but they can do what they want to do, and they might need a little extra training, and having other people see that is the best way to spread that word. So I think it's wonderful.
Do you have someone with us today you'd like to introduce?
Right over here.
Go ahead. You introduce yourself.
Hi, I'm Hunter Clayman.
Hi, Hunter. Thank you for being with us today. Can you tell me, what have you gotten out of being part of the Project Search project?
Be happy and make new friends.
Be happy and make new friends. And wouldn't we all like to do that in our employment search? Hunter, thank you. I'm glad you joined us today. And I knew where you were. I wasn't going to lose you. Nope. Nope. Linda, if people would like more information about this, who should they call? Should they call you, call the medical center?
They can call me. My number, I'm through the Career Center, but my number is 614-570-7769. And my liaison here at the hospital, who is amazing, is Janet Cooper, and she's with HR, and she helps me set up all the programs here in all the different departments, and she knows how to reach me every other way. So I would love, love, love to have anyone can contact me if questions, concerns, if you know of a student or their own child that could benefit from a program like this, or any other programs that are out there. So
thank you. Thank you. Fairfield today, we are on location at Fairfield Medical Center's sports clinic, work-life facilities. This is just a really long name. Outpatient Therapy Services, Work-Life, and Sports Clinic. We have had a wonderful day today with Corey Callahan and now Linda Ferguson with Project Search, and our special guest Hunter talking to us about the benefits of the Project Search program, and having them on today in honor of March being Developmental Disabilities Month. Of course, if you have any questions about any events, activities, or services provided by Fairfield Medical Center, the number you need to call is 740-687-8000, or visit their website. It is just a wealth of information, and that is www.fmchealth.org, because Fairfield Medical Center has people you know with care you trust. I'm Lisa Hooker. Thank you for joining us again for Fairfield Today, and we'll see you next time.
Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fair Hope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frank E. Smith Funeral Home, Ohio University Lancaster, and Lancaster Fairfield Community Action Recycling and Litter Prevention.